3 minutes out.
So I just need to still follow. So our first mark is 608, right? Yep.
Mm-hmm. Hello, everyone, and welcome to Pikeville Medical Center's Workforce Innovation Center. I'm Jill Dotson with the City of Pikeville, and tonight with Pikeville Medical Center. Over the next couple of hours, we are going to be here to discuss some extremely important information with you and to give you some resources and tell how you can help with the recent flooding that has severely impacted our entire region. On February 15th and 16th, communities throughout eastern Kentucky were devastated by both flash flooding and river flooding that we had not seen the likes of in over 30 years. More than 20 lives were lost across the state of Kentucky, 4 of those here in Pike County and 1 in Floyd County. I'm joined now by Pikeville Medical Center President and CEO Donovan Blackburn. And Donovan and I are going to be together tonight, as I said earlier, to discuss so many different ways that our community can help their neighbors and their friends and families. And also, we're going to be providing some resources throughout the evening with some assistance for people who have been impacted so severely by the flooding, just to help them get back on their feet and in that recovery effort.
You know, first of all, Jill, thank you for agreeing to host tonight. It brings back old memories. Jill and I, when I was with the city, spent a lot of time together in this capacity. But, you know, it's been, 3 years now since our last event within our community. And I had to go to Frankfurt this morning to meet with several legislators, and which I greatly appreciate, because the meeting wasn't necessarily just about the tragic flooding that took place, but it ended up turning into that discussion. Every single legislator that I went in to speak with wanted to know how things were going and if we needed anything. And it reminded me of Saturday night. All the days, unfortunately, run together for so many people. But receiving so many calls throughout not only the community but throughout the state and even parts of the nation that was reaching out, listening to the tragic news and wanting to know what they could do to help. You know, personally, I lived through the 77 flood and the 84 flood, and then a couple of years ago, 3 years now, the flood back in 22. And, you know, obviously this event was in between the 77 and the 84 flood when it comes to marking water. But when you look at the damage that this did in comparison to the 22 flood, because this was a river flood and not just a flash flood, though there was a lot of people impacted there as well. So Pikeville Medical Center, as always, we've got amazing people within our organization, and so many of our team and staff reached out wanting to know what they could do to help. And we've done a lot. A lot of our staff has been involved in flood recovery and going out and actually working, and you'll hear some additional stories today, so I don't want to get into that. But PMC is certainly not only a family, but we're a regional source for not only healthcare, but for doing what we're doing tonight. And it's the very least we can do because, as I said, no different than people reaching out wanting to know what they could do to help. Pikeville Medical Center wanted to know what they could do to help their community. So tonight is about, there is a fundraising part of this, and we've been advertising that now for the past couple of weeks. And we've been working with our good friends from ARH also, my good friend Holly Harris, jointly. But we wanted to really focus also on resources. We realize now that, we're almost a couple of weeks past the event, and folks are now in the recovery stage and looking for what resources in order to help rebuild. And that's what a lot of tonight is about, is to try to provide those resources while also giving our great community to do what they always do and to rise the occasion to try to help those that are in need.
So we're not alone in this building tonight. We have friends that have been with us on different telethons and informational events. But we also have a whole host of media outlets that are partnering with us tonight. Television, radio, Facebook, websites, all these sorts of things from 6 to 7 are going to be streaming our broadcast, but also then at 7 o'clock, from 7 to 8, we're going to be live on WYMT, bringing you more information, more stories, and taking those calls. I do want to mention also that tonight, if you're near Pikeville, that we are on the campus of the Workforce Innovation Center. It's just behind the Landmark Inn, and you can swing by, you can drop off your donations, whether it be water, cleaning supplies, what have you, or if you want to drop off your monetary donation, you can do that as well. We will have several live broadcasts throughout the evening to tell how you can help, how you can give, how you can donate. And then if you are a victim of the flooding, then they will be giving those resources also to help you be steered in the right direction so you can have all the information that you need.
Well, you mentioned the media sources, and when we reached out to all of our media friends, immediately everyone and numerous sources joined in and said, we want to help, and how can we help? And so I sincerely appreciate all those that are broadcasting this live on social media and then on radio, and then also, as you mentioned, we've got some live feeds coming out soon as well. So I want everyone to understand, as we flash the how to give in just a moment, 100%, as always, through our foundation, the PMC Foundation, 100% of these proceeds will go to help those through the flood recovery within our area. So again, there is no administrative cost, no fees that we pull aside. 100% of these donations will go towards flood relief.
If you're looking at your screen right now, you can see ways to give, 606-791-2963. There is also a QR code there that makes it just a little bit easier that you can scan. Again, that number is 606-791-2963. And as I mentioned earlier, if you are in the Pikeville area or will be in the next couple of hours, you can come by the Workforce Innovation Center. It's right behind the Landmark Hotel in Pikeville and drop off your donation. You can walk in your monetary donation if you choose to do that as well. But again, that number, 606-791-2963.
Well, and Jill, very proud because so many of our own employees have given. We allow them to donate vacation time that's turned into cash. Our vendors have really stepped up immediately upon the first day, calling, asking what they could do to help as well. So I would also add that if anyone is looking for, and you'll hear some of those various components here tonight, looking for resources to help, you can also log onto our website at www.pikevillehospital.org, and there is not only the donation component there, but there's also a resource component there that will list numerous resources that's available that we try to bring all under one roof so that folks that may have a particular need in one area can go down that pathway, or if it's elsewhere, they can go down their pathway as well.
So I think we're going to have our first guest. You mentioned how your employees give someone who has covered a great deal of flooding over the course of her lifetime, especially in the last 10 years, is your employee now, Shannon Deskins.
Okay, we're going to turn it over to Shannon. There she is. Okay.
Yes. Thank you guys so much. And yeah, it has been a crazy couple of weeks where we're dealing with another disaster. But one thing we've proven year after year for as long as we can remember is that we overcome adversity. We're tough mountain people. And I am with Tammy Riley, Public Health Director for Pike County right now. And Tammy, this is something that you guys know in your group, that you hit the ground running when this happens.
Absolutely. The public health, my team, I'm proud of my team. Really appreciate the partnership that we have with Pikeville Medical Center. So, you know, it's community partners coming together is what this is all about tonight, and in moving forward in the recovery, the long recovery process.
Absolutely. And I know one of the big things that I've seen on your Facebook page, and we're in the social media age, and I'm glad that we have that because so much information is put out there. Vaccines has been a big thing with you guys, even though you've even mobilized to go out. Talk about what you're encouraging people to get and who should get it.
You know, in regards to the flood response, what we're encouraging, we're looking at hepatitis A vaccine and Tdap. Tdap is a combination vaccine that includes tetanus protection. So these are normal vaccines that are just part of a child's normal, you know, immunization process. Most children have these vaccines in their first year and a half of their life. Tetanus is a little different in that it has this 10-year booster. So a child will get a tetanus or a Tdap. It's a combination vaccine at 11 years, and then at that point moving forward, ACIP, the Advisory Council on Immunization Practices, recommends every 10 years. You know, and when you're in an environment like we are currently with a flood response, what has happened to our water systems is there's been contamination, sewage contamination. So you look at hepatitis A, for example, that's a fecal to oral transmission. Tetanus is, you know, that's a very rare but serious and deadly disease. And there's bacteria, and if that bacteria gets into a cut or wound, you know, tetanus could be the result. And we don't want that. You know, public health is about prevention. And, you know, hepatitis A and tetanus, these are preventable diseases. And with the debris and the floodwaters and, you know, early on our water systems were contaminated, we're still under a boil water advisory, you know, throughout much of Pike County. So, you know, it's really important that individuals, you know if they've been vaccinated, if they need a booster, that Tdap tetanus booster, and also very important that, you know, I know not everyone knows this, but the Tdap and the Hep A vaccines are free. If you're in this flooded area, and almost all of us are, right? We've been exposed to the water systems or the debris, or we've been out there volunteering. You know, you need to check your vaccine schedule. The vaccines are widely available. You know, we have extended hours. You know, Pikeville Medical Center, our partner, has these vaccines. So if you're working during the day or you work at night, someone is open and has these vaccines available for free.
And, you know, we think about the water being down, and it's not just the water, it's the mud. It's everything else. So who do you recommend to get this?
Everyone. Like I said, Hep A and Tdap is just part of the normal, you know, ACIP recommendations for children. The thing about Hep A is you only need Hep A once in a lifetime. It's if you're only vaccinating for hepatitis A, it's a 2-vaccine series, 6 months apart. Tdap every 10 years, that booster. You know, grandparents don't think about this. You know, that booster is important because you can expose your child to diphtheria, pertussis, you know, these younger children. So they're just vitally important, and we recommend them for everyone.
That's very important information, and it's great that you guys have opened and extended your hours, and you're just reaching out to do that. Now, you and I mentioned something that I didn't have in my notes earlier, and that is something, now that we've got the FEMA declaration, there are things that need to happen before you can go meet with them. And, you know, a lot of people, when your homes are flooded, these documents, very important documents may have been lost. So you have some information about what the new messaging is?
Correct. We have a vital statistics component to the public health across Kentucky. So we have regular communication, and we play a role in vital statistics. So what we have had communications with that branch, and that office will be in Pike County next week at the Disaster Recovery Centers, those DRCs. So starting next week, they will be there to offer assistance, but marriage records, death certificates, birth certificates, those vital documents of identification that are important to us for many reasons, but also may be required as part of the FEMA or flood insurance process.
All right, and I know that your Facebook page has been very active, and I know in our community that's a lot of where we get our information. So is there anything else that as we wrap here that you want to really get out there to the public?
You know, if you're WIC, if you're on a WIC participant, the Women, Infants, and Children, we have auto issuance. If you've lost food through that program that could be replaced, we can auto issue without coming into the office in most situations. And then the vital statistics that they're going to be here next week. And then the well water, we have the EPA mobile well water testing lab on the Pike County Health Department property.
All right, so a lot of information to get out there for the Pike County Health Department. So make sure if you're on Facebook that you follow that. And Tammy, thank you for joining us this evening.
Thank you, Shannon, and thank you, Pikeville Medical Center, for including public health.
All right, and I think now I'm going to send it back. Jill, you've got a guest that you want to talk about?
I do. Shannon, Tammy, thank you so much. Some great information there. So with me now is Josh Ball. He is the Chief Operating Officer of SOAR, also a good friend of mine. We've been doing things like this for a long time. Josh lives in Johnson County, that's seen its fair share of flooding, and travels our region with SOAR and has seen so many devastated areas. But first, let me thank you for being here. And the information that you're going to provide us tonight is for our business owners, our disaster loans, small business loans, how they are alike, how they are different, how do they work?
Yeah, so Donovan mentioned earlier about how the hospital centralized assets and information, and that's what we did at SOAR. You know, we're a convener, a dot connector, and so for our small business communities, we felt it was vital to create a centralized place where people could understand the Small Business Administration's loans programs, where they can find those centers now. They're located here in Pike County and also in the surrounding counties, but also grants and loans that can help with emergency funding through SCED, the Southeast Kentucky Economic Development Corporation, and Mountain Association. So $1,000 to $100,000, no interest for the first year, low rates, so really helping our businesses get back open, because a lot of our small businesses are the fabric of our local communities, and getting them up and running is critical to our recovery, but also for our communities moving forward.
So, you know, throughout the course of the year, and certainly during the holiday season and things of that nature, we always promote shopping local, supporting your friends and neighbors, supporting small business. Right now, it is imperative that those that are still open, that we make sure we stop in their doors and say hello.
Yeah, absolutely. Small business is big business in Eastern Kentucky. They are our Toyota, they're our manufacturers, and they're the reason that we can go out and sell Eastern Kentucky to bigger companies and ask them to come invest. The first thing they look at is a vibrant downtown and a strong small community, a small business community, and that's essential. And right now, it's as important as ever that we support those that are still open, but we also help those and encourage those to open their doors up again and you know, to continue to roll up their sleeves and get to work every day.
And that's what we do. That's what we do here. The SBA team is going to be set up soon. Can you tell us when and where that's going to be?
Yeah, so you can go to soar-ky.org. We have a button there for our Business Recovery Hub. So there you can find where the Small Business Administration is going to be. You can also find important information about the loans that I mentioned from SCED and Mountain Association. Again, direct links to go there. You can apply. And then we have a lead form there. If you have any problems accessing any of that information, a member of our team will reach out immediately and help our small businesses navigate not only the SBA, but also our local funding opportunities as well.
As we wrap up this portion, as I said before, you've seen a lot of flooding. in and around Eastern Kentucky. You're an Eastern Kentucky native. We were talking just before we came on live today about what you saw as you drove into Pikeville today. It is really blows your mind.
You know, pictures and drone footage really doesn't do it justice, but, you know, there's a bigger story in this, and I think when the waters rise, our people rise, and I think this is just another chapter in the history of Eastern Kentucky where we are showing the country that we don't give up. When something happens, we roll up our sleeves, we lean on one another, and we find a way to the brighter tomorrow. And that's what we'll do again and again, because that's just who we are. We're not taught that. It's just ingrained in our culture. And this is just another punch. But we don't get knocked down. We always get back up. And things like this is critically important because it's going to take all of us. The need is important now, but 30, 60, 90 days, 6 months, a year from now, people are still going to be rebuilding their lives. And it's important that we do everything we can to help our neighbors.
I've had a couple of different entities who are here with boots on the ground helping out tell me that it's a marathon, not a sprint. And I think we all need to be very mindful of that. It's not going to go away quickly, but it will go away eventually, and we'll recover.
Absolutely. I oftentimes like to write. I'm a writer, and I said, you know, as we look at the wreckage, that's not our story. And then I think it's important to remember that while that's what we're seeing now, the bigger part of this story is what we're doing tonight and what we're going to do in the weeks and months and years to come to help us rebuild and to become bigger and better because of it.
Absolutely. Josh Ball with SOAR. Thank you so much for being here. I know your phone lines are open. The website is there with all the information that our businesses need, and thank you so much for what you do. Right, Josh Ball. So now we're going to go to the phone lines. We mentioned earlier that we are taking donations tonight, either at the front door, if those are cases of water, cleaning supplies, things that people will need to begin their lives again. But we also are going to do some fundraising tonight, and Carly Lambert with the PMC Foundation is here with us tonight, and she is with some wonderful Pikeville Medical Center employees and volunteers tonight.
Thank you, Jill, and thank you so much, Josh, too. We are so appreciative of our partnership with SOAR, and you were right when you said small businesses are vital to our community, and those resources will make a big difference whenever they're trying to rebuild. So as Jill said, I'm here with some of our awesome volunteers. These are all PMC employees who have volunteered their time to be here, and so they are taking our calls. They're going to be taking your donations. So you can call in at 606-791-2963, or if you'd rather give online, you can visit our website, www.pikevillehospital.org. And there's really a lot of ways to get involved. Like Jill said, you can come around. We're reporting live from the Workforce Innovation Center behind the Landmark Hotel. So stop by and see us and bring a donation in person. And I would like to remind everyone that the foundation is a 501c3 nonprofit, so all of your donations are tax deductible. And as Donovan mentioned earlier, 100% of those funds will be going back to our community. So I'd like to send it back up to Donovan and Jill.
Carly, thank you so much. And like I said before, these are all Pikeville Medical Center employees that are volunteering their time tonight. You did mention earlier that you've had several employees, Donovan, that have donated vacation time that turns into money.
Right.
So with that, I think that's just an incredible opportunity for your staff. But as we look out into the community and we see different groups stepping up and doing things, we have had so many people from out of our area that have come in to offer assistance, that have used our student volunteers throughout Pikeville, and so many different people that they just said, hey, do you want to help? And they come and they help. So we're really thankful for your employees tonight and the way that they're donating their time.
You know, extremely proud. And you know, our healthcare industry was labeled during the pandemic as healthcare heroes. And this event was another example of that. Everybody has their story, and it's not to belittle anybody else's whatever tragedy that they went through or what they've experienced, because I know our community is certainly hurting, and we want to be there. Together we rise is our motto, so we, as a spin-off of that, together we rebuild is what we kind of focused around when setting up this telethon. Again, looking at resources. if you look at the night of the event, we had our annual heart ball plan that night, and decided to cancel it just for the standpoint of the safety of the guests coming in the community. At that time, they were forecasting the river to peak at a certain point, and it continued to go up and up that night. But during that night, we saw our employees that a lot of them that were going to be impacted by the flood stayed at work to ensure that their patients, once again, was at their top priority or is their top priority. But not only stayed, we had some employees, Jill, that were there for 3 days that couldn't go home because where they lived was flooded. So again, to continue to contribute to not only their patients, but also to contribute in a way to help their community. And then Pikeville Medical Center being the single largest employer within the region, we had a couple of hundred employees that were directly impacted. We had 44 employees that lost everything. And so that, again, hits not only close to home. I know there's so many stories of that throughout our community, but again, that's one reason why PMC, we felt the need to step forward to make sure that what resources were out there were available and accessible, so that as we continue to rebuild and to plan our lives, that we can certainly move forward, help them move forward, while also having our employees to be part of this.
Absolutely. So let's show everyone the number again, if we can, that they can call tonight to donate. There's also a QR code that you will see on your screen at the moment. The ways to give, 606-791-2963. Also, you can go to pikevillehospital.org. All different kinds of flooding information is there and information on how you can donate. You can also scan the QR code that is currently on your screen from your tablet or smartphone, and it will take you straight to where you can donate. Again, all the money raised tonight goes to the PMC Foundation, and 100% of everything that is given tonight will be directly donated to the foundation for recovery efforts.
But Jill, as we go throughout the night and we talk to the various guests within our community that came forward, and they have a story to tell also because there's resources available. But PMC, we consider ourselves a family, and the healthcare industry is a family. And it is truly people like Tammy Riley who has stepped up and has become not only a partner, but a great family member. And look at, again, ARH's role. They had an event just like this last week that we assisted with, and we appreciate what they do for our community and the partnership. But also we have great friends like Mike Cottle over MCHC, who during the 22 flood event, they were impacted, and we were there for them. And Mike called me a couple times in text, and they were here for us, sending over additional supplies to ensure, again, those that were impacted were taken care of. So we're proud of our healthcare family and certainly proud of our community.
We are, and as you mentioned, we have a lot of guests and friends that are going to be joining us tonight to tell about the resources within the area and ways that you can help or that you can get assistance. Shannon is with us once again. She is standing by with a very special guest.
I am, Jill. Thank you very much. And I love the fact that we're doing the fundraising component tonight. But I'm like with our whole group. I love the fact that we're getting the information out about the resources, because it's so easy to feel lost when you've lost everything. And I've got Sandy Penix here with me, and you're with Pike County Relief Services. So first of all, thank you for joining us, and give me like an overview real quick of what you guys have been doing.
Sure. So Pike County Relief Services, we were born out of the July 22 flood. And basically we started as a Pike County Long-Term Recovery Group, and we've been in place working with flood survivors throughout, and then this happened. So we're so thankful that we were still in place. And so basically what we do normally is long-term recovery, working with resources. Right now, my role and our role as a team has been connecting resources, people calling in, people getting on our website and saying, hey, I lost my dentures in the flood, or hey, I need this, or just different things you wouldn't even think of. So we're trying to help respond to that and other things that come up that people may not even know about.
And you guys are very hands-on, and you know where the boots on the ground are. Every morning since this has happened, there's been an emergency operations center meeting, and you're very vital in that. So if they come in and say, like I've heard recently, there's a need for empty propane tanks. So you meet with a group and you put an order in.
Yes, so I'm actually part of the Kentucky VOAD. It's a wonderful group. I meet every night at 7 o'clock. I'm going to miss that tonight, but I already put in our order. But it is the group of volunteers on disaster relief, and it's a huge number of charitable organizations that want to help. And so every night we go on and we say, here's the new needs. Pike County, we need propane. No, now we need squeegees. No, now we need generators. No, we don't need generators. So it changes from day to day, but it's just been a wonderful opportunity to help with that connection.
And the big thing that's been in the news lately is the fact that we've got the FEMA declaration and things are happening. Flood relief happens in stages. You've got different things that happen, and now there are a lot of things that people need to think about. So let's talk about, there are things like the first things you need to do before you ever meet with a FEMA rep.
Yes, of course. You know, and I think Tammy touched on that earlier. Tammy Bradley, our lovely, wonderful Pike County Health Department Director. There's a lot of documents that you're going to need to bring, and there is a website, and you can get online with FEMA and actually view those documents. But there are things, you know, just to prove who you are, where you live, and you want to just, you know, you don't want to just walk in. You want to take a look at that. And there should be a lot of information on our Facebook page, and of course, Pike County Emergency is sharing that as well. But we want to make sure people know, go in if you would like to the Pikeville Library, 7 a.m. to 7 p.m., 7 days a week. That started this morning. And you can go in there. They're located on the 3rd floor. This is located at 126.
I think it's Lee Avenue. Lee Avenue.
I think what we're all saying is next to Burger King in Pikeville. So if you want to go in there, they also have Red Cross, and they also have the SBA there for businesses, because we know they have been affected very heavily in our area. So we want to make sure they have that as well.
Right, so I think we've got some information on your screen, the Pike County Library, and then the Belfry Branch Library also. And that's 7 days a week from 7 in the morning till 7 in the evening.
The Belfry Branch is simply just a DRC, yeah. But the Pikeville, where you can go for 7 a.m. to 7 p.m. And when Nee gets here, our wonderful emergency manager, because let me just tell you, it changes from day to day. And I think there were some changes even this morning. I think you and I talked about that earlier. So he can give you the direct, but this is where we need to go.
And I think real quickly, we've got one more screen that we want to put up there about what you need to do before you ever go meet with a FEMA rep. Take photos. I think that's super important. Take pictures. Go ahead and get started mucking it out. The longer you wait, the harder it is to clean it out. Make a list of your damaged items. If you have insurance, you do have to file a claim.
Yes.
And you can apply online or go visit the person.
Yes. And you know, the judge is suggesting, and we are suggesting too, if you can, it's much easier to go in person, because you can get everything settled in one time. So, yeah. But one other thing we want to mention is the crisis cleanup. This is such an important thing. Real quick, crisis cleanup. This is for mucking, debris, and tree removal. All of our volunteer organizations like Samaritan's Purse are coming in and looking at this list of families that are in need, and they're responding. We have a large group coming in this week from a church, and it is 606-268-0896. And all of those volunteer organizations, there's 148 families in there now. We want there to be more, because that number will close next Friday, March the 7th.
Okay, and real quick, I know Pike County Relief Services, you have a Facebook page. Are you sharing a lot of this information?
Yes, we have a Facebook page. I'm oversharing probably, but no. You can go to our Facebook page. You can go to our website, pikecountyreliefservices.org. There's all kinds of information there as well.
Thank you very much. And as Sandy said, things are changing daily, if not by the hour. Yes. And we're going to have guests throughout the night. You've already seen some. So we've got lots of information that we're going to be bringing your way. Some information that Pikeville Medical Center put out recently was about, we talked about documents, but what if you lost your medication? And I think Jill has someone now who can help us with that information.
Absolutely, Sandy Shannon. Thank you so much. So yes, one of the things that people often lose during tragic events like this is their medications. They don't have time to leave their homes, and they're worried about their families, so they forget those vital things that they need to help them live or to be healthier. So Tabitha Hamilton is here from the PMC Pharmacy. Tabitha, thank you for taking the time to be with us tonight. So she is the director of the outpatient and specialty pharmacies at Pikeville Medical Center, and we know, Tabitha, how important that medication is. And like I said, a lot of times that's not what people think about first when they're trying to get their families and their loved ones out of a home. So what can be done about their medications that they may be without?
So patients can't go without these medications. So all they really need to do is call us or come see us, and we will get the information that we need to get them taken care of. So if you have your prescription bottles, you can bring that. We'll use those labels to get them taken care of. If you don't have that, most people at some point have been to the hospital, so we can look in the EHR and get your medication list. And if that's not possible, we'll contact your doctor. And as a last resort, we can take the patient's, word of their medication list and get it from that.
Absolutely. Governor Beshear last week issued an executive order that allows pharmacists to do that. And if anybody has a question or is worried about that, that makes it perfectly clear that they do not need to worry.
Right, no, they do not need to worry. We can go ahead and do a 30-day emergency fill of their maintenance medications, and that's for non-controlled medications.
As you've been in the pharmacy over the last few days and you've seen people come in who have been victims of this flooding, what are some of the questions that they have, or what has been your interaction with them?
Mostly people just come in and say that they don't know what to do, and that's okay. We'll take care of it. You don't have to worry. You got more important things to worry about than your medications and how you're going to get them. So we'll take that off your plate. We'll call the doctor. We'll do whatever we need to do. We'll call the insurance, get the overrides. We'll make sure that the medication gets into their hands.
One of the things that is so prevalent in our area of Eastern Kentucky is diabetes, and diabetic supplies are critical to someone's life. I know that you've probably seen a lot of diabetic patients who have lost insulin pens, who have lost maybe vials of insulin, needles, that sort of thing. Those are all things that are covered with this.
Yes, of course. All non-controlled medications can be taken care of. We call your insurance, we get an override, they cover it, and then you get your medication as usual.
Tabitha, thank you so much for being here and for the work that you do and all of your staff does at the pharmacy. It is critical that our members of our community are taken care of, where their medications are so critical. Now, there is a number to the pharmacy that they can call.
Yes.
And that is 606-218-3576.
Yes.
If they have any questions about their medications, or of course, if they're able to, they can come into the pharmacy that is open 24 hours a day.
Yes, they can come in anytime or call anytime.
Tabitha Hamilton, thank you so much for being with us. We really appreciate it. Thank you for the work you do.
Thank you.
And thank you for how you are giving to so many in our area, whether it be flood supplies, cleaning supplies, clothing, food donations, but also your monetary donations. Carly Lambert is once again with our volunteers at our phone bank. And Carly, how's it going over there?
Thank you, Jill, and thank you, Tabitha. That's some great information. We definitely don't want our patients to go without their prescription medications. So if you've been affected, make sure you call our pharmacy at 606-218-3576. Now, continuing on with our broadcast, we still have our dedicated employees here taking your phone calls, taking donations. And what makes our PMC team truly remarkable is that many of our employees were affected by the flooding as well, but they continue to show up and give it their all because they truly care about their patients and our community. So every donation makes a difference. We're still here. You can call in or you can donate online. To give us a call at 606-791-2963. Or visit our website, www.pikevillehospital.org, to give online. And just a reminder, we are a 501c3 nonprofit, so all of your donations will be tax deductible. So I'll send it back up to Jill and Donovan.
Carly, thank you so much, and thank you for the work that everyone at your phone bank is doing tonight. Again, these are Pikeville Medical Center employees, and they're volunteering their time, so a big, huge thanks to them. I do want to reiterate the numbers one more time on your screen. A lot of people may not get them jotted down too quickly, so if we can see that number one more time, 606-791-2963 is the number that you can call to make your donations. 606-791-2963, or you can also, if you're watching, you can scan the QR code that's on your screen, and it will take you straight to those donation prompts. Donovan Blackburn, we've had a lot of information shared tonight. A lot of different guests have been with us this evening. And I just want to reiterate the importance of calling or stopping by the PMC pharmacy and speaking to Tabitha, or one of her pharmacists there, one of her employees, about the critical importance of making sure you take your medications during this time, that you do not try to skip, that you do not think, we'll just go a couple days without it. That's not what we want at all.
No, absolutely not. As a matter of fact, it's extremely important you stay on that regimen, and we've made it easy. Unfortunately, Jill, like so many other businesses that were impacted, one of the local pharmacies was also impacted. Mm-hmm. So those patients that utilize that pharmacy panicked. So many pharmacies stepped up within the region, including Pikeville Medical Center. From PMC standpoint, very proud of our pharmacy and the product that we have and the services that we deliver. As I was listening to Tabitha talk, just a couple things I noted real quick is that we also have online ordering. So once you become a member of the PMC pharmacy family, we have easy prompts that you can follow for online ordering. The pharmacy is open 7/24, 7 days a week, 24 hours a day. We have a pharmacist on staff all during those times. We have a convenient drive-through, a 3-lane drive-through, where you can actually pay by credit card. And then one of the things that a lot of people in the area don't realize is that we also offer delivery service to anyone living in the 41501. So a big part of the area that was actually impacted by the floods, all you have to do is pick up the phone, call the pharmacy, and we'll bring those medications to you. Now, there is some restrictions in what we are not legally allowed to transport, but for the most part, we should be able to take care of most needs, and certainly appreciate the leadership within the community, including the governor for signing the executive order. This was a very important piece of legislation in order to make sure that those folks were taken care of.
So make sure that you take your medications, you do not skip. Make sure you call the pharmacy to get those prescriptions filled and those needs met. Shannon has another guest with us this evening, Freddie Bowling. He is with Pike County Schools, and Pike County Schools has been doing a tremendous, tremendous service to those communities that are impacted. Shannon.
Absolutely, Jill, they have, and it's an honor to have Superintendent Freddie Bowling with us tonight. And I saw on Facebook earlier the week, and I think a lot of people were sharing a post about you feeding a lot of students. Can you tell me a little bit about that?
That is correct, Shannon. We have a lot of needy families, a lot of needy students across our area, and this was an opportunity for us to feed them while we were out of school. So Monday, we fed over 45,000 meals to our kids, and that's ages 1 through 18. And they received enough meals, 5 breakfast, 5 lunch for the entire week. And Monday, we're going to do it again. So I would like to commend Lisa Hess, my food service director, and her staff. They really just went out and they worked hard. We had volunteers come in, but really to service our kids, that's what it's all about.
And that's something I think I missed when I saw that post, is that you didn't just feed them on Monday. They came and you fed them all week. So I commend you and your staff for planning ahead like that.
Thank you. We've got a great staff.
Now, speaking of your schools, we're talking about the flooding that devastated much of our region, especially Pike County. So can you give me a report on which one of your schools took on water, how they're doing now?
Yes, we were very fortunate. We only had 3 schools impacted by the flooding, and really that was just in the basement, and that was Johns Creek, Feds Creek, and North Point Academy. And the 2 schools, Johns Creek and Feds Creek, are done. They're cleaned up. There was just a little bit of water, and we're working on North Point. That'll be done next week. So our maintenance crew, they got it done, but we're blessed. It could have been much worse for us.
All right, and as we wrap up, let's look ahead to Monday. Let's talk about getting the information out of who may need to come, how you're going to get those meals delivered, in case they missed last week.
Okay, we will use our social media sites to push that information out. I will send out something tomorrow. Actually, I think it's on there tonight, so we'll notify families. Each school will notify through social media. So we're looking forward to getting our kids back in there and getting them fed again on Monday.
Thank you very much for joining us tonight. And out of the corner of my eye, while you were talking, I can see our phone still ringing. So I want to check back in with Carly Lambert again. She's standing by with Lisa Kendrick with the PMC Foundation.
That's right, Shannon. The phones have been ringing nonstop, and the donations are rolling in. It's so heartwarming to see how much our community cares for one another. And as Shannon mentioned, I'm joined with Lisa Kendrick. She is the VP of Development here at the Pikeville Medical Center Foundation. Welcome. Thank you for being here.
Thank you, Carly.
I would really like to ask you, why is the foundation so vital right now?
Well, not a lot of people really understand what our foundation is all about. The PMC Foundation for Quality Health is here not only to help our community like we're doing tonight, this evening, but also to provide that funding for that quality health care that we do for our community. So it's vitally important for our community for health care. We're right along with Pikeville Medical Center providing that. We also do grant funding, so we have fundraisers, so you see us out and about all the time, but it's very critical at this time that we help our community.
Absolutely. And you can be a part of that effort. If you want to call us here, we have 606-791-2963 as the phone number, and you can go on our website, pikevillehospital.org. And I'll send it back over to Jill.
Carly and Lisa, thank you so much. Again, thank you, PMC staff, for volunteering your time. We really could not do it without their support and their giving hearts. So Donovan and I mentioned earlier that we are not alone here in this room tonight. Not only do we have our friends at the phone banks, we have Shannon and several of her guests, but we are also joined this evening and are partnering with so many of our media outlets across Eastern Kentucky and really all of Southeastern Kentucky. So we want to send a big, big thank you to them tonight for being part of this broadcast. And like I said, nearly every radio station in our region, all the way as far west as Somerset, south to the Virginia border, streaming on WSAZ.com, ANI 360, CMH 23, several Facebook feeds tonight, and of course, on all of the stations of Mountaintop Media, WPRG, and WYMT Live will be joining us at 7 o'clock. We'll be live there from 7 to 8 o'clock this evening. And Donovan, really, I mean, as we've gone through a lot of telethons, a lot of recovery efforts, a lot of things, donation drives, food drives, so many different things that, you know, I've been a part of in my career, but also in yours and your many different capacities. You cannot do it without local broadcasting stations and local media being strong partners in what we do.
Jill, absolutely. And as I mentioned earlier, it wasn't a matter of me making the call. Most of the media sources within the area are familiar with us doing this, and so I had almost every single station or outlet and social media gurus out there reach out and say, what can we do to help? So we decided to wait a week. Again, we sincerely appreciate our partners at ARH, Holly Harris and their foundation. Last week basically did the same thing from the standpoint of a telethon. They were on WYMT and the Lexington affiliate as well. So being in that part of the state, we wanted to do something with our own community because so many people had reached out. Fundraising is important because people need help. And all these different resources that are in the community will certainly be there. We want to do our part as well. And as I mentioned, not only is it the media sources, it's the vendors. It's also a lot of our local leadership. And, you know, Jill, I can't say enough. And I'll be honest with you, I was thinking a moment ago, and you hear a little stutter, I've been up since early this morning. I had, as I mentioned, early drive to Frankfort. And so a little bit of a long day, but was excited to get back to do what we're doing tonight. This is the highlight of my night or my day, realizing all the hard work that our staff, all that they went through to put these resources together to make sure that they're available to our community. And then, I jotted a couple names down as we were coming, as I was coming in this evening, and I certainly personally want to thank a lot of our local leadership. They, Jill, we are very blessed. We're blessed. The Pikeville Medical Center has been around 100 years, and we've certainly seen our fair share of events like this, once-in-a-lifetime pandemic. I mean, we could go on and on. But what words you hear over and over within our community is the resilience of our people and all that they do to step up and to help one another. And it really is friend helping friend, family member helping family member. There's so many agencies that showed up on the night of the event. To see the photos being placed on social media was just so humbling to see. And we shared a story talking about our first responders and seeing our own local fire chief in a wetsuit in the water doing swift water rescue, and living in the city environment for as many years as I did. It's really interesting to watch them train, but really is what really is humbling is when you really see them in action at the time of need. So many photos, you just can't help to be overwhelmed. So now it's our turn. It's our turn to continue to step up, share resources for those in the community. Again, we ask you if you can, not just to donate. It's not about money. It really is about resources. It's providing those folks that show up and shovel muck out. It's people that are donating time and whether it's furniture or clothing. But if you can't afford to give, we understand. But if you can give in other ways, and it is not just by material, it's people giving of their time and giving their prayers and really holding hands and touching people in need, just going through the community saying, I see you, and we won't forget you.
That's exactly right, because I think, we all think of ways that we want to help. And you and I and Shannon had this discussion yesterday about how you want to help and you want to give and you want to get up out of your work seat, if you will, and go and shovel and go and do and go and provide. And there are so many different avenues that the need is there. There has to be planning. There has to be facilitating of emergency management services, of making sure that all of the volunteers are coordinated. And everybody can do their part in some little way. It doesn't have to be monetary. Your time is what people need, or that listening ear. Donovan mentioned, as we've seen our first responders and people that you work with every day, that I certainly work with every single day, that are my colleagues, they're my work family, they're my friends, and to be able to be with them. It was about 2 o'clock last Sunday morning, or Sunday before last, that I saw them jump into a lifeboat and float across or swim across, several of them did, to rescue people in the Lakeview community of Pikeville, which is right behind Walmart. If you're not familiar with the Pikeville area, that entire area, there was no way in and there was no way out except by boat.
Absolutely.
Or if you were rescued by one of our Swiftwater Rescue team members, to see your friends doing that in their element and their capacity brings a whole nother appreciation for what they do and what they train for. They train to never have to do it, but they train because they will do it at some point. And I can't think of a better transition than to join Shannon again than with someone who has seen so much over the last several days and who has been right in the thick of things every night, every morning. I don't know when he has slept. I don't know when he has had a moment to catch his breath, but we are so appreciative of Nee Jackson and the work that he does with Pike County Emergency Management. And I just think it's a wonderful opportunity tonight to hear from him. I know that he just came straight in from a meeting to join us, so we really appreciate him. Shannon.
Thank you, Jill. And we did get Nee here, and we only have him for just a few minutes. So trying to decide what in the world you're going to say to the man with all this knowledge, I don't know. But Nee, something you said in one of the EOC meetings, I don't know if it was earlier last week or early this week, that just ripped my heart out and made me realize the extent of what we're dealing with, was the number of people who had to be rescued last Saturday night.
Yes, we throughout the county rescued over 600 people, which is over 1% of our population. And also another program that we had a weather radio grant program last year in April. And we have given out 4,400 of those 5,000 weather radios. And to think that we rescued over 1% of our population via boat on Saturday, between Saturday and Sunday.
I mean, think about it. If you're going to the grocery store or you're going to Walmart, 1 out of 100 people that you're going to see here in Pike County had to be rescued by boat. That shows the magnitude of the flooding that we experienced.
Absolutely. And I mean, this is a monumental flooding. Probably since 1977, we haven't seen countywide a flood this large. We had 2 rivers flood at the same time. So we were touched from every corner of the county. You know, being a county that's 789 square miles, we've got over 1,000 miles of just county roads. The people don't understand the magnitude of the size of our county, and it stretched our resources from the swift water teams. You know, we sent our first team from Belfry, the Pike County Technical Rescue. We sent them to Elkhorn City to evacuate the nursing home. So, and then the next group went to Dry Fork of Shelby. So, you know, we were spread all over. And then, you know, later on, we ended up rescuing 86 people out of Tug Fork Apartments. So, you know, it was spread all over the county at all hours of the day and night.
And that's just, the magnitude of that is hard for us to understand. One thing I want to talk about, and we've got a graphic about the distribution centers, or the pods that you guys have talked to them. Now, the graphic we had as of this morning has changed. So the way the things are when you get pallets and truckloads of the supplies in, they go to the Appalachian Wireless Arena. That is not where the public goes. No. That is taken out to these distribution centers. Talk about how that works.
Absolutely. We primarily use most of our fire departments as our points of distribution, and we started out with 19 points of distribution. We're down to 14 as of this afternoon, and we shared that on our Facebook page. I've sent it out to some of the local media outlets, so please share that. A lot of these places, for instance, they were doing water only. They weren't affected by the flooding itself. So as the boil water advisories have lifted, that's allowed a lot of these places to start scaling down their operations.
So, and the response is amazing, how things have happened. Like, I know, I just asked you if we still needed propane tanks. Earlier in the week, we needed propane tanks, and you said that need has been filled for the most part.
It has, but looking at the forecast for the weekend, Saturday night, we're supposed to be at about 22 degrees for the low. Sunday night, we're supposed to be down to about 20 degrees for the low. So that need may arise again. So, you know, don't let your guard down. There's still cold weather to come. And as you know, if you don't like the weather, just give it a minute. It'll change.
And we have certainly seen that over the past 10 days or so since this flooding has taken place. But I know one thing that you're encouraging people to do now that FEMA is on the ground is to take action. I was talking to C.J. Childers just the other day, and he said something to me I really hadn't thought about. He said, don't wait. People are waiting and not starting work. Document and go ahead and get that started.
Absolutely. Take pictures, take video. If you've got video when the water was actually up, that helps tremendously. If somebody were to come out and look and you don't have a watermark, but if you've got those videos or still pictures, that's a great thing to have. So a lot of people video their homes on the inside prior to for their insurance companies and stuff. That's also some great documentation to have. And they're also in these disaster recovery centers. I heard you all mention earlier timing. Looks like on Sunday it's going to be from 1 until 7. They've scaled back the time on opening on Sunday to 1 o'clock. So they're going to be open from 1 until 7 on Sunday. But they're looking for that documentation. So there'll be different branches. Later in March, we're going to have some different branches to be able to help with driver's license, marriage license, those type things if you lost a Social Security card, so that it'll kind of be a one-stop shop.
So I think that's one of the things, Donovan has talked about. We're attempting to pull this resource page together. Emergency management has a great source. SOAR has a great source. The chamber has a great source. So it's trying to pull them together to kind of be the one-stop shop. We've gone through a lot of changes since the flood happened, and I'm sure we've got more to come. So where are we now? And then I know you've got to run, so kind of where are we now with what the needs are?
We're in the cleaning phase. We're in the recovery phase now. So cleaning supplies, there's a cleaning supply called Shockwave that is a mold remediation. It's used by all the large companies that and the organizations that come in because this is something that can penetrate those porous areas. A lot of the mold remediation stuff doesn't penetrate the porous areas. And once you get those studs exposed, you spray it and you leave it for like 48 hours before you actually start back. So it actually dries as well. So that's a huge thing, Shockwave. Rakes, shovels, wheelbarrows. They can get stuff out, but then they've got to wheel it somewhere to get rid of it, get it out of their house, get it out of their yard. So wheelbarrows are a huge thing right now that we're looking for as well.
And one thing, and I know I'm keeping you late, and I'm going to have to apologize to the judge for that, but I heard the highway department, the District 12, when people are bringing their garbage out, you've got to be careful not to put it in the right-of-way because then you've still got the trucks and this stuff that goes by. So is there a place where people need to put the debris? And I know you have to separate it.
Right. Separate it. Make sure that you get as close to the right-of-way as you can. Right now, earlier in the event, we were looking at snow plows coming through, so we're like, don't push it all the way out to the right-of-way, but get it as close to the right-of-way as you can. And when they come through and start making passes, they'll pick everything up as they can.
All right, and the last thing is something you had on your phone, and we don't have the graphic to show you, but we will share. And tell me about this graphic. I know that means a lot to you.
It does. This is something that I mentioned in the very first briefings that we had. We have a briefing Monday through Friday at 9 a.m. every morning, bring all of our partners in, and it's one team, one voice, one mission, united, hashtag Pike County Strong.
And I know that gets to you.
Yeah, it does, because from the thin gray line to the thin yellow line, the thin blue line, the orange line for search and rescue, the red line for fire, and the green line for the military. And we've taken all those folks and molded one team, and we're speaking one voice for Pike County.
Nee Jackson, thank you very much for joining us. I know, and I'll let you scoot on out because you've got to run to a meeting with the judge, but we appreciate everything you're doing.
Thank you. I appreciate it. Thank you all for all that you're doing.
All right, and while he is stepping out, we're going to take just a second and welcome someone new.
We are Shannon. Thank you so much. And welcome to everyone who is now joining us live on WYMT. We appreciate your time and you taking just a moment to be with us this evening. My name is Jill Dotson. I am with the City of Pikeville, and I'm coming to you tonight with my friend Donovan Blackburn, who is the President and CEO of Pikeville Medical Center, as we help our friends and neighbors and those in our community who have been so heavily impacted by the recent flooding in eastern Kentucky. There are so many people and so many lives who have been touched, and so many who are in need tonight. And we're here tonight to provide those resources and to raise some funds to make sure that the recovery process goes just a little bit easier. We're going to be live right here on WYMT and across many of our streaming media partners, radio broadcasts throughout the region. Donovan Blackburn, it has already been a wonderful hour of hearing stories, of hearing resources, of hearing so many different ways that people can give, that people have given, but also how we can continue to help. This recovery effort is not going to be short-lived. This will take months to years to completely rebuild and to get back what was taken away so quickly just a few days ago. So again, thank you for joining us. We hope that you are able to stick with us for the next hour as we give some wonderful and vital information about how you can help in the recovery effort, some resources that if you are a victim of the flooding that you can reach out to. FEMA is now on the ground in Pike County. There are so many different organizations that we're going to hear from. Samaritan's Purse is one of those organizations. and several other people that have been so impactful over the last few days. Certainly tonight, we're going to thank our PMC employees and volunteers this evening as they're working our phone bank to take care of donations that you call in. You can also call 606-791-2963 to make those donations. And if you're in the Pikeville area and you would like to donate anything like cleaning supplies, water, blankets, dehumidifiers, generators, anything like that that you want to donate, we can take those here at the Workforce Innovation Center. We're located just behind the Landmark Hotel in Pikeville. Very easy to find off of US 23. It will be exit 23 that you take. And just look to your right and you will see where we're located. But we will certainly take those donations here. Again, to call to donate, 606-791-2963, or by scanning the QR code that is on your screen. Donovan Blackburn, you have been in every area that has been impacted since the first waters hit. You were trapped at one point in your home and could not get out because the Levasso Fork crested and spilled over the banks. We know that onto US 23. It shut down the Buckley's Creek intersection that we refer to here in Pikeville on US 23. And that's something I never thought I would see. I stood in the middle of US 23 on Sunday morning at 7:30 in awe and could not believe what I was seeing.
Jill, it was surreal. And, we know a lot of people in our community are struggling. We have employees, I mentioned earlier in the broadcast, that are struggling. Over 44 employees that lost everything, over 200 that were impacted directly. So many of our businesses up and down 23 and up several hollows and in various counties were all impacted, different than the 22 event, which was a significant event, flash flooding compared to a river flood, which, as it came up to your point, being trapped is surreal. But also, when you start looking on social media, seeing people wading through knee-deep water and then up to their waist and then up to their chest, and people being rescued, now's the time that we need to step up for those folks. And we're doing that in a couple different ways. We're doing that typically whenever there's a disaster such as this. Pikeville Medical Center, as a community partner, tries to pull resources together. We did something a little different this time. On our website at www.pikevillehospital.org, you can actually find a resource page to where a lot of the stuff you will see on social media is all now at one location. So you can give there also. It goes to our foundation. Or, again, you can find resources that would be beneficial to help with the rebuilding.
A lot of different resources on that page. Also, Josh Ball was with us in our first hour. SOAR has a wonderful resource page on their website as well that you can check out. And of course, all you have to do most of the time with these wonderful organizations that we have is just to scroll through your social media. And so many different organizations have been diligent about getting that information out. So there is a great response to pushing out resource information for those who are impacted and for those who are wanting to help. So many people have already helped this evening, and Carly Lambert has been at our phone bank with our wonderful PMC employees and volunteers for the evening, and she joins us now to tell us a little bit about how you can call in and the avenues that you can take to do so. Carly.
Absolutely. Thank you, Jill. Good evening. As we continue our broadcast tonight, I wanted to talk a little bit about the PMC Foundation. So we are here tonight raising funds for the flood relief, and we have our dedicated employees here answering the phones, taking your calls, taking your donations. And as we know, families lost everything and they're struggling to recover, and the PMC Foundation wants them to know that we are here for you. 100% of all the money raised tonight and in our flood relief fund goes back to the community. So you can call in here tonight, 606-791-2963, or if you'd rather give online, that website is www.pikevillehospital.org, and I think you'll probably see a QR code on your screen at some point during the broadcast as well. So next up, I'm going to send us on over to Shannon and our good friends at ARH.
Thank you, Carly, and this is one of those guests that you wouldn't have expected to be on our broadcast tonight. But we're going to clear up some rumors. We were just standing here talking. So I actually have Angie Bailey and Rocky Massey with me, and you guys are with the ARH Foundation. I know that's a longer name, but you can tell me a little bit about what you guys do and why you're here tonight.
Well, Rocky is actually with ARH, and I am with the ARH Foundation for Healthier Communities.
Absolutely, and thank you. Yeah, the ARH badge is a little odd, but hey, we are partners in this.
We're absolutely very close partners. I'm very honored and humbled to be here tonight. I want to thank Donovan and Lisa for putting this outstanding event together so quickly. We truly value, ARH values our partnership with Pikeville Medical Center, especially this evening when we're coming all together to help meet the needs of the people who have been devastated from this terrible disaster that struck Eastern Kentucky again.
You know, and what we're doing tonight is similar to what you guys did a week ago. So talk to me about that.
So last week we did a telethon on WKYT and YMT. It lasted 13 hours. And we were very lucky to have the support of both those media outlets and our communities. And we are still, just like you guys, doing events because just like you guys, it's about our communities. It's about our families. It's about the people that we see and work with and live with every day. And so we too are working just as hard as we can go to make sure that we can provide the much needed supplies and assistance that all of our communities need.
All right, and one thing we talked about before we came live on the air was you said, I want to talk about my shirt. So let's talk about the shirt, the Kentucky Strong shirt that you're wearing.
So this is one of the many fundraisers, and this is not necessarily an ARH Foundation fundraiser. New Frontier is doing these shirts, and you can get them on our website or the link to our website. But all of the proceeds from the sale of these sweatshirts, and they also have some that say Appalachia Strong, are going directly to flood victims. So I think I have 3 or 4.
Okay, well, you said the website. Let's talk about, give us that address.
Sure, you can go to arh.org/floods, and you can get all the information about our efforts, where our distribution centers are, what items are needed, what items are available, and you can also get the link to this wonderful shirt.
Well, Rocky, you know, I'm reaching across you here. You got some things I know you want to talk about too.
Yeah, so I do want to provide some more details on those relief distribution centers that we have set up. You know, in 2022, we established a relief distribution center in Perry County in Hazard. They're in the Black Gold Shopping Plaza. We never closed that facility. And that facility today is still providing relief to an average of 200 people a day. Folks that need it, that have just been wiped out. And now we've stood up 2 more. We've added a site in Floyd County, in Prestonsburg, right on our Highlands ARH Hospital campus where we're meeting the needs of Floyd County. And we're seeing a lot of folks through there, and we're helping those folks get through their difficult times. Opening on Monday, right here in Pike County. Very proud to be able to do this because those poor people in Belfry were devastated. And we're going to open up a relief distribution center in Belfry, right there in the former Peebles building. We'll have that up and running Monday morning in an attempt to really help those people who just have been devastated.
And I want to thank you guys for joining us tonight. And like you said, we've all said it tonight. We'll continue to say it all the way through the end of our broadcast. And we're just doing what we have to do to take care of our people.
These are all of our people, and we are so proud to partner with Pikeville Medical Center.
Absolutely.
Thank you.
God bless.
And thank you guys so much. And like we said, it's all about gathering those resources, information, and getting it out there to the public. You can't help the public if they don't know what's available. So, Carly, I'm going to send it back over to you one more time and check on those phones one more time.
Awesome. Thank you, Shannon. And yeah, that partnership really just serves as a testament to the type of people here in Eastern Kentucky. We come together to help our neighbors no matter what. So we're here with our PMC and PMC Foundation team. They are taking your calls and taking donations. And you can call that number, 606-791-2963, and give your donation. No matter how big or small, every dollar makes a difference. There's also a QR code that will come up on your screen every now and then, so feel free to scan that. And you could also visit our website, www.pikevillehospital.org, or call in here. I think we're getting some calls now. So call in at 606-791-2963, and I will send it back up to Jill.
Carly, I love when you say that number, you see everybody in unison picking up their phone. So that's exactly what we want. We appreciate you so much. By calling that number, scanning the QR code that you will see throughout the evening on your screen, every bit of that money that you donate tonight will go directly 100% to flood victims and recovery efforts in Eastern Kentucky. Donovan, how was it to see your friends from ARH here in this building tonight?
You know, this is great, and you know, Jill, again, Shannon kind of alluded to the fact that people see us as competitors, but we're not. We're friends. Healthcare is a family. And, you know, realize that ARH and Pikeville Medical Center work hand in hand in so many different ways. Holly Harris, my counterpart with ARH, she is a dear, dear friend. We talk at least a couple of times a week in ways that we can work together to help impact the healthcare needs for the communities that we both serve. So very appreciative of not only ARH, but ARH Foundation. You know, Rocky's a great friend. He's a great guy. The entire ARH team are absolutely phenomenal. And you know, Angie working with Lisa with our foundation has worked hand in hand. As a matter of fact, not only did we participate last week in their event, but we have another event that both foundations are working on to where, again, 100% of the proceeds will go to help our flood victims. But, you know, it's hard to really put into words when you look across the aisle and you see a friend and they've got their hand out willing to help. And that's what ARH, if you look back at what happened in 22, a big area, which we're over in Whitesburg, we have a great specialty clinic and a clinic over there as well. Again, a great partnership with the ARH hospital over in Whitesburg, but that was the area in 22 that was mostly impacted, Neon and Jenkins and Whitesburg, et cetera. So, you know, during that time, we reached our hand out as much as we possibly could. And during this time, though, a lot of ARHs, as Rocky mentioned, over in the Belfry area, we've got a clinic. Referrals go back and forth. We make sure that patients, whether they're routed to ARH or whether they're routed to PMC, it's about making sure they have the best care. But one of the first calls that I received during the floods was from my counterpart, Holly Harris, and just her heart going out saying, you know, it's tragic, and we need to continue to work together and find ways that we can continue to help our community, not just from a healthcare standpoint, but just in general with what we do. We rise together in time of needs. That's what, and I keep using the word healthcare heroes because I'm very proud of what our heroes have done. There were so many heroes during this recent event. All you have to do is pick up Facebook and start flipping through it, and you'll see harrowing story after harrowing story of how different people came to the aid of different people, and this is no different. I mentioned we have an upcoming event. You know, every year we have our annual fundraising event, which is mainly driven by our vendors. Our vendors contribute money. This year it went to our autism center, as it did last year. During the night of the flood, on Saturday night when the rains came down, was our annual event. So we had spent over a week preparing with our vendors and our setup team to get the expo center ready. Because we canceled the event, we had a lot of food, so we sent the food all over to our staff at the hospital that had spent the night. But we also, part of that event is we have a table auction. And so we had multiple vendors within the community that had contributed some really, really nice auction items. We were able to save those auction items. We were going to use them next year. But as ARH reached out, we said, well, how about they made mention that we do an online auction together. I said the timing is great because we have all these wonderful items, and I'm sure that those who contributed would be more than happy to give for this event. We called each donor, and without a doubt, they said, absolutely, we support that 100%. So, we encourage everybody out there that, again, if you can't give today, because the event was last week, maybe tomorrow, maybe next week, when you see the online auction, the website will still be up. So it's not just about giving today, and it's not just about giving monetarily, as we mentioned earlier. It's about giving time, giving your heart, your compassion, your prayer, all the things that this community needs to be able to heal and to rise and to rebuild.
That's a wonderful way to put it, to continue to rise and rebuild. We have so many different organizations throughout Eastern Kentucky that work every day, not just during these devastating events that we see happening, but they're here every day working in our communities. And one of those ladies is Rachel Campbell Dotson. She is with the East Kentucky Dream Center. She is always working, always collecting, and always giving back. And no more can be said about her than this last few days with her efforts, and her team at the East Kentucky Dream Center has just done some remarkable things in our community. And Shannon is joined by Rachel now.
Jill, thank you. And yes, standing here beside someone I know is as tired as Nee Jackson was. The East Kentucky Dream Center and Rachel Campbell Dotson, the executive director, you guys don't stop on a regular basis when the weather is fine. And when things like this happen, you mobilize immediately.
The night of the flood, we set up at Shelby Valley High School. We were going to do a shelter there, and the water went off. Power was starting to flicker. So we shipped them out to some of the other high schools, worked with everybody. They say it takes a village, and it truly takes a village. From there, we immediately got on with our contacts, other dream centers from everywhere, Asheville, Tennessee, and we just said, we need things for flood relief. We need, we're flooding up here. We're families are already displaced. Rescue boats are in operation. We need help. By the next day, we started receiving items. Immediately, Monday morning, we opened our thrift store. The thrift store has been a huge blessing to this area. We had a lady and her entire family, five children, come in their muddy socks. They didn't think the water was going to get around their mobile home, but it did. So they had to come in and, it's just, there's something special about being able to give a family that comes in muddy clothes that they've had on for 24 hours, warm clothing, a hot meal, and just a hug and a smile to say it's going to be okay.
Absolutely. And those stories that you tell, I'm sure you've got countless stories. We were just talking about it yesterday. We all have stories to tell that have touched our hearts. And when you and I had a conversation yesterday, we talked about the fact that flooding recovery comes in stages. And you guys at the East Kentucky Dream Center are prepared for a lot of those stages.
Absolutely. The first stage, of course, is like I said, a hot meal and some clean clothing. Then you start with the cleaning up. Cleaning up is the pine saw, the mold remover, the Clorox, the brushes, the brooms. Then it goes into clean out. And when you go into a clean out method, just as Nee Jackson was talking about, you need the wheelbarrows. You can get it outside, but you got to haul it on further. You need shovels to pull your carpet, to rip up your hardwood. There's so many things, box cutters to cut out the sheetrock. So many things that these families are needing that we're not getting in yet. We're in dire need of that kind of supplies. So, drop off at the Dream Center, drop off at the arena. There's so many drop-off points still in operation.
And you guys, just like we've talked about tonight, a lot of, finding where the resources are. And you're very active on your Facebook page. Is that the main place where you get your needs out there when they happen?
Yeah, absolutely. Our Facebook and then our website, the www.ekdc.info. And we just, we're pretty much a 24-hour hotline for anything that's needed, diapers, formula. We have a team that's ready and willing and just boots on the ground at all times.
All right, so what are your needs now? We discussed this the other day of how things are. What do you guys need right now? I know one thing you mentioned that really struck home with me was gift cards to like Lowe's. We may be at that point now when they're needing to buy those kind of supplies.
The Dream Center is also doing fundraisers for flood victims and locals, but the reason that we do it is a little different. We try to give them a gift card. When they have to have their HVAC system cleaned out, it's expensive. And if you're already, in a high poverty area struggling, we want to be there to at least to try to put a Band-Aid on that.
And one thing I want to push too, because there are a lot of mothers with young children, with babies, and you guys have a special area just for that. I think you said you have the baby room.
Our new location on Hambley Boulevard, we offer diapers and formula. Formula sometimes is upwards of $30 a can. So if that's all washed away, you've lost your cards, you're just struggling, you're at one of the shelters or staying with a friend, formula is a big need. So we have car seats in right now. I think we've got some baby beds, crib beds, that kind of thing. They're gently used, but we're just here to bless the area.
So let's talk about your address. Where are you located? When do you have someone there that can help someone?
Our hours are 9 to 5 at our dining hall located on Hambley Boulevard, just down from Velocity. We have a thrift store that's located on South Mail Trail, and the South Mail Trail location is open 11 to 5 Monday through Saturday. That's where you receive the free clothing and the items. But we also have a location in Elkhorn City. That location is just, they've been on the ground running also, just blessing Elkhorn Creek and Mouthcard and Feds Creek. The ladies up there do an excellent job. They're full of clothing and some mattresses and that kind of thing also.
All right, you mentioned dining hall, and we'll close out talking about meals, because you guys are back to serving the public. You've done it, you did it before the flood, and of course the need is still there. So let's talk about when you're offering food.
We've teamed up with Mercy Chefs. They've done an amazing job feeding thousands upon thousands this week. But as of tomorrow, we'll go back to our normal meals every Wednesday, Friday, 11 until 1. You don't have to be needy. Sometimes you're just tired and worn down and you need a hot meal.
And you're there to supply that.
We are.
Thank you so much. Rachel Campbell Dotson with the East Kentucky Dream Center. Jill Donovan, I'm going to send it back to you.
The work that Rachel and her team do is absolutely remarkable. I see her in her regular capacity, not during work, but she still is trying to collect and to provide and to give and to organize. She never stops. So I know that she is exhausted just like so many others, but we appreciate her taking the time to be with us this evening. And we talk about how important it is to take care of your neighbors, to take care of your friends, to take care of the people that your kids go to school with, or they play baseball or soccer with, on different teams, like at the Y and different organizations we have. You may not have been impacted, but they have possibly been impacted. And it is so important to give to the Dream Center and to so many other organizations that we have, because you never know when it could be you that is the person in need.
Jill, absolutely, and that's why we felt it was important to focus more on resources during this event, because it's so widespread than it's just funding. As the declaration was declared and as FEMA has rolled in, and the resources that will become available, whether it's through insurance or FEMA or other opportunities for hopefully some subsidies or some funding, there's basic needs that need to be met right now. And to your point, Rachel talked about somebody coming in with socks, in muddy socks, and there was I saw a Facebook posting of somebody just asking for basic needs like a child's undergarments that was in desperate need. The things you don't really think about. We're really traditionally focused on getting rid of the muck and getting the debris out of the whatever's been flooded. But it goes beyond that. It's the human toll that it really impacts, and we see that every single day as part of as a hospital. We see, unfortunately, a lot of folks at their worst time. People that are ill, sick, have disease. But you don't see that so widespread on Facebook day after day, minute after minute, when something like this really impacts our community. So now that it's out there, there's an opportunity for the community to really step up and continue to help. And we want to help. I was looking, we've got a resource page. If you go to our website, we talk about our resource page. All that we've done is we've looked and kind of cast a net around everything that was on social media to try to pull it in. And that's what you'll find on our website.
Absolutely. Now, I know you did this, and I do this often, just because I think it's a remarkable thing that we have in our community, and that is Ryan Hall, y'all. And Shannon is with Chandra Thacker now, who is with that organization. I know, weekend before last, I was glued to my screen, and I was watching the updates that Ryan provides, and it's pretty amazing, Shannon.
It is amazing. I mean, I've got friends in Oklahoma, and they are addicted to Ryan Hall's YouTube channel. But what is more amazing than anything is the fact that Ryan has a nonprofit organization, and you may have heard of the Y'all Squad. This week, you may have seen the Y'all Squad truck in our own town. I could almost get emotional. And Chandra, you travel all over the country, and you hand things out to people. What's it like being in your own community this time?
First of all, I just want to talk about our community and just how resilient they are, and just being able to hug family and friends that has been impacted not once but twice in the last 2 years, and being able to give back to those that surround us. Ryan and I are from here, born and raised, and it's different this time because we were able to watch the water rise. She was talking about being live on YouTube. We got to point the camera directly at the Big Sandy River and see that rising into Walmart parking lot all throughout the night. And even then, I had to rush home because my road was getting flooded. So Ron was kind of left by himself at that moment. But anyway, once things like that happen, that's kind of where I step in. I'm the vice president of the Y'all Squad, and I'm able to be the boots on the ground in that sense. Meet with Sandy, meet with Nee, address the needs in the community, and really give back to those in need in a rushed time. So one of our big things is that we try to have immediate relief, be there before FEMA does, no matter if it's in Oklahoma or Pike County. We try to be there before. So yes, that's kind of our stance on that. We just try to be there when we're needed.
You know, and the number that I saw Ryan post on Facebook the other day is that you guys, you didn't have to deliver because it's here, 135,000 plus. Talk to me about that.
Isn't that crazy? Like over the whole live stream, Ryan was able to raise over $135,000, and we were able to put that money directly back into our community, whether it was supplies or monetary donations or even helping families. So,
And as we close here, one of the things that you said to me was you were able to take 3 families and do something you've never done before with these 3 families.
absolutely. Oh my gosh, I have chills even thinking about it, like hearing it just then. So for the first time ever, we were able to house 3 families for a whole year in Airbnbs. So these are elderly people. These are family of 6. These are people that lost everything. And we were able to provide them with a home for a year with all utilities included, furniture, everything. And just being able to give back when the people need it the most, which is a shelter over their head.
Well, Y'all Squad, thank you for all you do, and please share with Ryan also.
Yes, if you are interested in learning more, you can go to the yallsquad.org. We are a 501c3 nonprofit, and you can go on there, see what we do, donate if you'd like, and we'll be around for the long haul for this one. So.
All right, Chandra, thank you so much. And like we said, resources are what tonight's show is about, and it's sharing with you where these resources are and what they're doing for our own community. But of course, we can help others do more, especially here at Pikeville Medical Center and the Pikeville Medical Center Foundation, and we're going to check in with those guys once again.
Thanks, Shannon. And I'm back with Lisa Kendrick, VP of Development and the PMC Foundation. And those phones are still ringing, the donations are still coming in, and the foundation is making a huge difference in our community. And Lisa's going to tell us a little more about it.
Yes, Carly, we have a very small team, and 100% is going right back to our community because there's no overhead at the foundation. PMC takes care of all of that, so everything that's coming in through the foundation is 100% given back to the community.
Yeah, and so we've seen a lot of online donations come in and calls coming in, even from other states. So I think we have a couple.
Oh my gosh, Michigan, California, DC, Washington, Georgia, Tennessee, Ohio, Colorado, And then we have plenty of Kentuckians that's given back. I've seen Frankfort, I've seen Lexington, I've seen them around this area give back to their neighbors.
Yeah, that's awesome, and I love that we're all coming together for our community. So if you would like to donate, you can give at our website, which is pikevillehospital.org, or you can call in here and talk to one of our lovely volunteers. That number is 606-791-2963. And I'll send it back up to Jill and Donovan.
Carly, Lisa, thank you so much. They have been busy on the phone lines, and we certainly appreciate them again, Pikeville Medical Center employees, for volunteering their time this evening to answer the call and take those donations. We want to tell you again how you can donate. I know Carly just talked about it, but let's see that number again on the screen. It is vitally important that you get this number or scan that QR code. And Donovan has mentioned today is not the only day that you can give. You will be able to do that for a while. I'm not going to put a number on it or a date, but we'll just say a long while, because this is not going to be a short-lived recovery event. The ways to give: 606-791-2963, pikevillehospital.org, and scanning the QR code on your screen. Now, if you are a social media fan, all you have to do is go to Pikeville Medical Center's Facebook page. That QR code is all over it. All you have to do is pull that up and scan it. And again, 100% of the monetary donations raised, as well as the physical donations raised, will go to flood recovery efforts, the victims, their families, in the effort to help them rebuild and get back on their feet. Donovan, we have had the opportunity to tour several different areas, specifically here in the city of Pikeville, but also in the city of Coal Run. If you come into Pikeville to shop a lot, you travel south on US 23, or if you're coming from the south, you'll travel north to Coal Run. Such a heavily impacted area, places that we shop in every day, every week. We pass by there. Your employees, your 3,000 plus employees come from all over the region. They'll travel through Coal Run, probably. It is just something that you can't imagine the devastation until you're there.
No, you absolutely can. As a matter of fact, a couple of our employees that lost everything were in that neighborhood in Coal Run. And it is certainly surreal. As I mentioned earlier, on my way to Frankfort this morning, driving through and seeing all the debris sitting out. One of my neighbors and a dear friend who also cuts my hairs, salon is down there, and to see the damage and the devastation. And I had just been there the week before, and then now to see all the debris sitting in front of their salon just absolutely breaks your heart. The day of the event or the day after, during that night, I was out about 3 o'clock in the morning because our urgent care is right on the river, monitoring it to see where the floodwaters was coming up. My son lives over in the Kill Edition, right on the river. So like every other family, we were watching the river and also taking care of business. And then we got up the next morning, went home, got up the next morning at 6 o'clock and came back out. And to realize you're trapped. I live right behind Walmart. My neighbor, by the way, is Ryan Hall. So as I came off the hill and realized that I couldn't get on Cassidy, you couldn't get on Thompson's Road because all the property had been flooded around us. There was about 3 or 4 of us driving around, including Ryan. So Ryan Hall was out taking pictures and sharing it on social media, as was I, just trying to give our board an update. So again, it's just a surreal environment and event that occurred. People need resources. They need money, obviously, to help rebuild. But again, Jill, I want to put a heavy emphasis is that if you're looking, we have a resource page, and I keep mentioning it because it's really important. Whether you're looking just for general information, whether you're looking for healthcare needs, FEMA needs, housing needs, legal assistance, utility assistance, cleanup resources, you can find all that in one location now. A lot of what SOAR is also advertising, we've got there a lot of websites also on our website, so they will allow you to get to their websites also for that additional information. So if you need help, we want you to log on. Also on that same website, you can also give, and to your point, typically our foundation page is up all year. Those dollars usually go to things like the Ava Center. This year, for the entire rest of the year, those funds will be dedicated towards, all funds that come in will be dedicated towards this flood event.
Amazing. Absolutely remarkable what our small community can do in the time of need. Brenda Gooslin is one of the most respected realtors in Eastern Kentucky. She has also toured the areas and has some wonderful information and resources for us tonight, and she is with Shannon now.
Thank you, Jill. And yes, Brenda Gooslin is a familiar face when it comes to real estate here in Eastern Kentucky, but tonight you're representing East Kentucky Realtors and the state. So talk to me about your role, first of all, there, and welcome for joining us.
Okay. So I am a past president of the Eastern Kentucky Association of Realtors, and our jurisdiction is 13 counties, starting in Wolfe County, going to Harlan County. I have been president 6 times of the Eastern Kentucky Association of Realtors. I'm presently a director, state at large, for the Kentucky Realtors. And the reason why I'm here is that we've got a situation where if you will go to our Facebook page, Kentucky Realtors, and we can actually we have a link there and a QR code that you can go to if you are a flood victim, and you can get up to $1,000 for a month's 1 month of housing. And also, so you can go right there. You can upload your ID, upload pictures of flooding. If you own your own home, you upload a copy of your deed. Or if you've got a mortgage, you upload a copy of your mortgage statement. Or if you're leasing, upload a copy of that so that we got documentation that shows us how much you're paying. And if you don't have you're actually renting from month to month, you can actually get your landlord to make a statement and sign that and upload that to us. So in 2022, the realtors, the Kentucky Realtors, National Realtors, we brought in approximately $1 million worth of aid to flood victims here in Eastern Kentucky. And on Tuesday, this last Tuesday, we had a realtor, Lee Brown, who is a great friend, who brought in a truckload to ARH. Tomorrow, we have 2 truckloads coming in, one to Eastern Kentucky, which will be brought to ARH there in Prestonsburg, and Eastern Kentucky Realtors and Ashland Board of Realtors will be there to unload that. And we've got another one. So Josh Summers, our CEO, and our president, Barb Curtis, will be bringing those in. One load will be going to southeastern Kentucky. So,
And that is amazing. And one thing I want to touch about, you said these are not low-interest loans. These are actually, you're going to write someone a check up to $1,000. And even though it's a realtor, as you think of being a homeowner, this, like you said, you could rent. Mm-hmm. So that is up to $1,000, right?
Yes, yes. And so please go to Kentucky Realtors Facebook page and apply, because if you don't apply, you can't get it. And it is money that is coming to you. You will not have, you don't have to account for it. So please do so. It is for your housing.
And thank you so much for joining us tonight and helping share the information. Again, we've said it all night. It's about the resources. And the deadline to apply for these grants that are coming out is April 30th. So make sure you get on there and do that. And let's check in with Carly, who's standing by one more time at their phones.
Thank you, Shannon, and thank you, Brenda, for that great information. So we're coming into the last half hour, and our team is still here. They're taking calls. And even when this program ends, we know that it's a long-term effort, so we will still have that online website up, pikevillehospital.org. And Lisa is going to come back here in a little bit and tell us more about how to mail in. But as of right now, we want to say that we just appreciate your generosity. So we're still taking those calls for 20 minutes. And you can make a difference. If you want to call us here at 606-791-2963, or you can give online at pikevillehospital.org. Or if you're out and about in Pikeville and you want to stop by and see us, we'll be here for a little bit longer. We're right behind the Landmark Hotel. So thank you once again, and I will send it back up to Jill and Donovan.
Carly, thank you. You all have been doing tremendous work throughout the evening answering those phones. I don't think that I've seen one moment tonight where not everyone has been on the phone, so that's really encouraging. And you know, Donovan, this did not start out to be a fundraising event. This was a resource, informational time where we wanted to push out that information, and then there were so many people who wanted to give, who wanted to donate, who wanted to make a difference. So we're not calling it a telethon, so to speak, but we will certainly take those donations and put them to tremendous use.
Absolutely. We want to make sure that if help is needed, that we're there to give as much help as needed. And whether that's through monetary donation or whether it's simply just by connecting people with what resources that they need in order to get the help that they need. So to your point, if you go to our webpage, on the top of the webpage, you're going to see the banner. The banner will either say to give or it'll have the resource page. So you can click on the resource page. We have a PDF that can be printed off that, again, I keep referring to. It's this page. Here, it's a 3-page right now. We continue to update this. It has all the different websites that you can go to, or the contact names. It also has the various counties that were impacted with reference for their contacts as well, where you can get whether it's a shower, a hot meal, water supplies. Again, a lot of information for those that will need help.
Absolutely, and I'm glad that you mentioned the different areas, because we know in Pikeville and Pike County and the surrounding area, particularly our Coal Run area that was so heavily impacted, those are just a couple of the areas that has seen such devastation. But let me tell you, if you have the opportunity to go out and to travel around and to see the different areas, it really is something to see, and will put things in perspective for you, for your family, for your children, to see what can happen in a very small amount of time. Not just here in Pike County, but our friends in Virginia, in the Grundy area, in Williamson, West Virginia, all the way up to Logan. It is just tremendous, the impact that this flood, as Anise said earlier, when you have 2 rivers that flood at the same time, not to mention the smaller tributaries that impact those rivers as well, it is just something that, quite frankly, is hard to wrap your mind around. So that is why we're doing this. This is why we have so many different resources and opportunities for you to give throughout our area, not just today and not just tomorrow, but in the weeks and the months and possibly the year to come. I can tell you that last week, we were right in the thick of things. The water had just started to crest when I got a phone call from someone that said, Samaritan's Purse will be in town at 6:30. Can you make it? I knew what Samaritan's Purse was. I knew the impact that they had with Operation Christmas Child and the shoe boxes that everyone is so familiar with. And I knew a little about the organization and their outreach that they did when tragic struck. I never imagined that within 24 hours of those waters starting to recede, that Tuesday afternoon, large tractor trailers would be pulling down Hamley Boulevard by police escort and into the parking lot of First Baptist Church to set up their operations center so they could start to help and to heal the people of Eastern Kentucky. I was fortunate enough that Tuesday afternoon to meet a wonderful person, and who I now call my friend. Her name is Jamie Kioshin, and she is the project manager here in Pikeville with Samaritan's Purse. She joins me now. I feel like I've seen you just about every day, but I had not seen you today yet.
No, not yet.
So, Jamie, thank you for being with us tonight. I know you're incredibly busy, and you are all over making sure that your teams and your volunteers are deployed, but I want to give you this time to explain to our viewers a little bit about what Samaritan's Purse is.
Sure. Samaritan's Purse is an international organization. We work around the world, but also domestically. And As you have seen, we are here in Pikeville, Kentucky, wanting to help these people that have been flooded in their homes.
It's not just today that you're going to be here, but you're the one that said to me, this is a marathon, not a sprint. This is not going to be quick. It is not going to be painless, but it will be impactful. And you're here until that last work order is filled. So talk about how people can call the number for Samaritan's Purse and how they can get on that work order list.
Sure. If you are needing any sort of assistance due to the flood, you can call our number. It's 833-747-1234. And you would call and someone will answer your call and talk with you, talk through what has happened there with the flood. They want to listen to your story, and they'll be patient with you on the phone, but they'll get some information that we need to be able to fill the work order out. And as soon as that is accomplished, an assessor team will give you a call and come out, make that appointment, and come out and make an assessment of what needs to happen. And then later on, a team will come and visit and bring all the tools and bring an army of orange T-shirts to your home to help.
So we have some video of the past few days that you have been here. It is incredible to see them go into a home, and when the homeowner is there and they're completely at a loss, your team goes in and they remove everything that is needed, the sheetrock, the flooring, the carpet. You see there, they're removing furniture and boards, and to stand back and to watch them in action, a team of volunteers, is just, it's so impactful. And certainly when they're in the homes of the people that I know and that I see every day, it hits home just a little bit closer.
Yes, ma'am. We bring the team to that home and try to love on that homeowner. They're going through a lot. They are still, and you know this, they're still in shock. They really don't know where to turn. And so our people are there to come alongside of them and just be there for them, be that hands and feet of Jesus out in this community.
There's also another group that is here providing prayer and comfort, and that is the Billy Graham ministry team that is with you all as well.
Yes, ma'am. We also have the chaplains that go out with us, Billy Graham Evangelistic Association, rapid response team chaplains, and they are there for that emotional, spiritual support for the homeowners as well as our volunteers, just because of all the devastation that they're seeing and what the homeowners have gone through. They need someone to talk with, and they are there to help and be there for you as a homeowner, to talk with, to pray with, to listen to your story.
It has been my honor and my privilege to get to see your team start to work. And I can tell you that you've been to a lot of different deployments, I know. But to tell you that the people that I know whose homes you've been in, how impactful it is to them, how appreciative they are. And at the end of that time, you circle around them and you pray with them and you give them a Bible. That is something I didn't expect when I was at a friend's house watching this team work. But I can't imagine what a feeling it is for you to know what a difference your team is making in this part of Eastern Kentucky.
It's what we do. We love helping, and we have the heart to serve. Helping in Jesus' name is, you will see that on our trucks. We are here to love on those homeowners.
Let's give that number one more time that people can call if they need assistance.
833-747-1234.
Jamie Kioshin, thank you so much for what you do. Thank you so much for your team and the impact that they're having in our community. It has just been tremendous, and we're so thankful and blessed by your efforts.
Thank you for having me.
Thank you for being here. It is one of those things that you never expect to happen in your community, that you never expect to be impacted. But in a blink of an eye, floodwaters can rise. They can impact your home in places that you never thought it was possible. That is what's happened here in Eastern Kentucky, and that is why We are here tonight doing a small part to provide resources to you, to give you information on how you can receive assistance, on information on how you can give to those family members and community members that have lost so much. You can do that by calling tonight. Carly is here with us one more time at the phone bank that they are still going to take your call for about 9 more minutes, but not just tonight, tomorrow and in the weeks to come. Carly?
Thank you, Jill. Yes, so we're coming up on the end of our program here, and I'm joined again by Lisa Kendrick, who is going to tell us a little bit more about how folks can stay in touch and stay involved with the flood relief efforts.
Absolutely. Tonight's been phenomenal. Phones have been ringing. Actually, we've been watching online donations coming through. Again, it's phenomenal for what we're doing. But you can continue even past the 8 o'clock hour. You can visit our website. We have everything on one location at pikevillehospital.org. It also gives you an option to do a mail-in, so those who do not want to actually do something online or to call in, that they can actually download the form and mail it to us.
And what is the address that they would need to mail that to?
That is Post Office Box 2515, Pikeville, Kentucky 41502.
Awesome. Thank you so much. And so we want to say thank you again for your generosity. We have just been overwhelmed by the support that we have received. And so I'd like to say goodbye and thank you.
For now.
Goodbye for now. Please keep up with us and visit our website. And I'd like to send it back over to Jill and Donovan.
Carly, Lisa, thank you so much, and thank you again to our Pikeville Medical Center employees who tonight are volunteering their time to answer the phones, pick up the call, take your donations, and to give you the information that you need. Donovan, when we do these sorts of events, they seem to go so quickly. And we talked about this yesterday in our preparation time, that when you're asking for people to give, or you're telling people and providing information that they need, it's an impactful part of my day. It has been the favorite part of my day that I've had. And I've looked forward to this event. You know, we have done a lot of these over the years together, but never has it hit so hard, I don't think, right here in our community, that we can drive along US 23 and see the impact go to any of our Facebook media outlets, anything like that, and see the impact from a picture standpoint. This is why we're here. This is why we do what we do. And it's not going to be just today, like Lisa said. It goes past 8 o'clock this evening. It goes past this week. It will go past next week. There's going to be a need for a very, very long time. This is just your opportunity to gain the resources that you need to see how you can donate and provide assistance and look for volunteer opportunities, because it's going to be here for a while.
You know, Jill, it's a very good point, because I know people still yet who went through the 22 event that are still rebuilding. They haven't completely recovered. So to your point, people are they're gonna have needs for quite a while, and we need to be there for them for quite a while. You know, certainly I appreciate you and your friendship and all that you do for the community. Jill volunteered to do this. This is what she does, and she's very good at it, and I know she's got a phenomenal heart. The city's very blessed to have you in the capacity that you're in, but I just want to say thank you. Likewise, there's a lot of folks out there that, as we wind down, and you know, our resource page is going to be up for some time. We update that daily. So as a matter of fact, there's been several things that's been announced tonight here at this event that we're going to be updating our page over. So as you'll see the page come out tomorrow, it will have updated information. So that will be available. But I mentioned earlier, you know, several folks that reached out, and I want to continue to just take a moment to say thank you, because as we saw this event hit our community, and we talked about all the folks that really stepped up, you know, the countless hours that a lot of our officials in the area. We talked about emergency services and first responders. But when you look at Floyd County, Johnson, Pike County, of course, our own county judge, Ray Jones, has done a phenomenal job. He's been out day in, day out. Mayor Andrew Scott, because of what happened with Coal Run, you know, Andrew actually, his regular job, he works for Pikeville Medical Center, he has for some time. But also as the mayor of Coal Run, just did a phenomenal job keeping information out. Of course, my dear friend and Mayor Jimmy Carter, who he and I have worked together for many, many years. I call him my brother. Again, just did a great job in keeping us informed of what was going on in the city. Of course, Elkhorn's Mayor Bryant. Floyd County Judge Robbie Williams is a dear friend of mine, and to see them in action. And of course, Prestonsburg Mayor Hughes is a great guy. We also have the McKenzie Judge Executive from Johnson County, and Mayor Runyon also. So, these officials pulled resources, kept the public informed, kept in conversation with the governor. And speaking of the governor reached out. Rocky, I spoke to him several times. It was actually in Frankfurt today. But Senator Wheeler sent me several texts during the event, Representative Blanton, and President Stivers as well. But you also had, I won't say surprised because he's a good friend of mine, but our Ag Commissioner Jonathan Schell, early in the morning sent me a text and said, "What do you need? What can I do?" And ran into him in Frankfurt today and had the same conversation. And then my dear friend, who's always been here for our region, Congressman Hal Rogers and their staff. Karen Kelly, as Chief of Staff, is a dear friend of mine, reached out. The Congressman reached out. Again, just making sure that federal resources were flowing in. So a lot of people, outside of the agencies that we have here tonight have played a pivotal role in making sure that all these resources that we're able to sit here and talk about tonight are available to the public in their time of need, and will continue to be here once the hoopla, as they say, is over. Once the spotlight has dimmed, is when people need help the most.
That is exactly right, and that's what I was thinking as you were speaking. It's not just today and in the immediate need. There will be a need for, like I said, weeks, months, and possibly years to come in this area of people that have been so heavily impacted. We do want to give the information one more time where you can call, the website that you can go to for resource information. And while we're looking at that screen that you see, 606-791-2963, or scanning that QR code, I do want to thank our media sponsors that gave of their airtime tonight to stream from 6 to 7 and then from 6 to 8 and then live here on WYMT. We appreciate your partnership more than you could ever know, because it is this region where our families live, our children grow, and we thrive here in Eastern Kentucky. So thank you for your effort in being our broadcast partner tonight. The last group of people that I want to thank tonight is someone that you see every day, is somebody that you see in the grocery store, at church, at work. Just pass them on the street, or they may drive by you. But I would be remiss if I did not thank our first responders, our police, our fire, our water rescue teams, our EMS directors throughout Eastern Kentucky, Virginia, and West Virginia. On that night, when everything started happening, there were over 600 water rescues that took place that evening. That is more than 1% of Pike County's population. That is an impactful number when you think about the water rescues that took place, people that were trapped, but people that were saved. And we just, our hats off to them. We cannot thank them enough for their effort and their willingness to risk their lives to save others. Donovan, it's been one of those, like I said, those evenings that it makes you thankful, it humbles you, and it gives you hope.
Amen. And I'll close out with our motto here as part of our organization. Together we give, together we'll rebuild, together we'll pray, and together we will rise.
Absolutely. We want to thank you all for joining us tonight, and we appreciate your support and your contributions more than you know. Have a good night.